Plant your feet firmly on the ground with the knees over the hips. So what it says, the feet, plant your feet firmly on the ground, knees over the heels, knees over the heels. Lift the hip. We have to lift the hip as much as it feels comfortable and slowly lower them again. Perform this exercise 10 to 15 times or more. Best mark 30 to 60 seconds and repeat for 5 times. By seeing this all the small physical exercise, you may think that is it can able to do by all the people are not proven. This is a WHO recommendation and guidelines. Itself it says that whoever according to their age and their health conditions and their status, whoever can able to do, they have to do it. So those people having the obesities and they can't go for these all activities, they have to go for the mild walk, what I have said previously, like walking, stand up, those positions, those they have to do it frequently. So this exercise strengthens your gluteal muscles. Chair tips. Chair tips. Hold on to the seat of your chair. Just we are holding. The seat of chair we are holding. Hold on to the seat of your chair with your feet about half of meter away from the chair. So we are keeping the feet half of meter away from the chair. Away from the chair, bend your arms as you lower your hip to the ground. So after we have hold the chairs and you just kept your feet on the floor. So when you're trying to bend, ultimately the knees also are bending, the glutes is coming down and the elbow is getting bent. So this exercise you're supposed to do it 10 to 15 times, that is each positions. After 1 time you have maintained, you have to take a rest for 30 seconds. Again, you have to go the same positions like 5 times we're supposed to. Tell the patients you have to do it. So this exercise strengthens the triceps muscles because there we are giving more stretch on the triceps muscles on the upper arm. So the muscles will be tightened and it will be strengthened. So this is a chest opener. Just look at the position itself says the name of this exercise. Chest opener. So just interlace your finger behind your back. Interlace your fingers behind the back. Stretch arms and open you. That is stretch arms. So back side you are stretching your arms and interlacing the fingers and forward opening of the chest. Forward opening of the chest. Hold this position for 20 to 30 seconds or more. So this will what happens, we'll be getting the benefit of chest and position stretches your chest and shoulders. Shoulder and chest muscles will be tightened and strengthened. Child's pose. Child's pose. So with the knees on the ground. So knees on the ground. Bring your hips to your heel. So knees on the ground. Hips to the hips. Hips to the heels. Hips to the heels. Rest your belly on your thighs. So belly on the thighs, hip on the heels, knees on the floor. So and actively stretch your arms forward. Forward. So just the position itself is gives like a child position. So that's a breathe normally. So when the patient will be in this position, they have to breathe normally. Inhale and exhalation is supposed to do it normally. Hold this position for 20 to 30 seconds or more, they can do it. So what is the benefits of this position? So this position stretches the back, shoulders and the side of the bodies. This is the meditation, seated meditations. Meditations, we can do it, we can advise the people to do it either they are in the sitting or lying down positions. Whenever they are doing some work in the officials work, we will be advised to do it. How calmly they have to sit in such a place and they have to do it. Sit comfortably on the floor with your legs crossed. Make sure your back is straight. Close your eyes. Relax the body progressively. So deep and breathing. Deep breathing. Hold it for 3 to 5 seconds and again deep exhalation. So concentrate on the breath. So trying to focus on any, not to focus on any other thoughts and concepts. So this will help to relax the mind. The meditations will help you to relax the mind. This is the simple. There are lot of meditation measures, various methods or various types of rules. The patient will difficult to do it and practice and follow. The simple measures we can make them to, we can teach them, we can make them to practice and follow it in order to have a clear mind, to have it breathing clearly. Then this is all the people can't do it. Those who can kneel, those people can do it. Legs up the wall. Bring your hips close 5 to 10 centimeter. This is from the wall, close to the wall. And let your legs rest. Close your eyes, relax your body. Progressively deepen your breathing. So just slightly we are bringing our hip towards the wall. The legs rest on the walls. So slightly we are relaxing our breathing. So try not to focus. So this pose they have maintained for the up to 5 minutes. So this is meant to comfortable, relaxing and de-stressing. The stress will be relieved. De-stressing positions. When you maintain this, there are some physiological hormonal changes is taking place. So those hormones is responsible to reduce and to alleviate our stress. So far we have seen some of the physical measures, the basic, simple, physical, healthy habits, the COVID-19 as well as the general populations, what we supposed to follow to be as a physically active to fight away from the COVID-19. These are the physical measures can follow it by the COVID-19. We have to follow. So coming to the diets, what are the dietary guidelines as a COVID-19 people have to follow? Not only again and repeatedly saying on the every points. This is not only for though I have prepared and for the WHO guidelines as given for the COVID-19 patients. We are living in the riskful world. Not only environment we can't say we are living in the risky world. We all have to follow this healthy active habits to away from COVID-19. Hippocrates, I think we all know that because Hippocrates is the father of medicines. He was a Greek physician. He was the father of medicines, and 2,500 years ago itself, he said that the food be the medicines and medicine. This is all the core what we all know that just simply and remembering to follow, to get back and we have to follow it. Food be the medicines and medicine be the foods. So what the food we are, each and every food what we are eating, it's having some medicinal value that we forgot it. So we can get back and we can practice in our day-to-day life. So to go for the actual dietary habits, we'll be thinking that this is the actual health habits we have to follow in our day-to-day life to be as a healthy. If you think, we'll be telling always that small and frequent eating. If you can't eat at a time to reach your satiety of stomach, to keep the fullness of your stomach. So always we used to advise the people to have a small and frequent diet. Yes, then this is the habit will also keep your metabolism active throughout the day. Because once you have the food, your metabolism will be activated and will be active. And we will be telling that junk food is well known to be high in calories and fats. Yes, we all know that the chocolates, biscuits, and chips, everything is all the junk. Even what is the pizzas, burger, everything is high calorie and high fat. We know that, but we don't know what is loaded what are the unwanted chemical which is present in the junk food. So yes, we are forgetting the unwanted chemical which is present in the junk food. So make a healthy choice now by avoiding the temptation of going towards the junk food. So daily nutrition and food related habits, what actually we are following in our day-to-day life actually. So make a point, we always insist that people, and we also always to do practice, we never miss a breakfast, because once we have taken dinner at night and breakfast, we have a lot of time gap, like 10 to 12 hours time gap we have, so that time the what the food you have taken at the night, it was digested. In the morning, the stomach is empty. The hydrochloric acid will be secreted. If you are not taking the breakfast, so you'll be going for some acidity and ulceration formation. So we always, since the people who take it proper, this is actually what we are following. But and if the people is to have the habit of taking coffee and tea, yes, they're addicted on day-to-day lives. So morning and evening, they're supposed to take a coffee and tea like that. People have addictions, and we also we are telling that tea is a healthier diet. You can have it, that you can practice. This is our actual health habits, what we are following. Then people have some fruits, but what then another thing is we always tell that at night we should not have a full stomach. Yes, before that, because yes, in order to avoid the full stomach, we always advise, and we also are practicing before the dinner we can take a little fruits. So this is the general actual habits what we are following on day-to-day life. So coming to the nutrition and the COVID-19. So as a COVID-19 patient with the people with the COVID-19, what are the food habits they're supposed to follow? Optimum dietary habits. COVID-19 pandemic, the nutritional status of individual has been used as measures of resilience towards destabilization. Interesting. This is a statement and the guidelines given by the WHO. So what it says, the people nutritional, those when they have adapted the nutritional guidelines and following, this is a good measures of resilience. Resilience means because of COVID-19, or ultimately that is the generally their health habits, the health status is becoming down. So when we follow the dietary measures, we can get back the resilience, so to get back of our health status. We can get it back to the health status, normal health status. Optimal nutrition and dietary nutrient intake impact the immune system through gene expression, cell activation, and signaling molecular modifications. Yes, the optimal nutrition, because the COVID-19, the first and most task, the people, those people will affect easily those who have the immune deficiency, the lack of immune power. So through the dietary supplements, we can improve the immune system and the immune power of the people, and we can activate that. When the immune power is activated, automatically all the cell and tissue functions will be activated. Nutrients and COVID-19. The balanced diet will guarantee a strong immune system that can withstand any assault by the virus. Yes, if the people are taking the balanced diet with all the nutrients, they will be having the strong immune power, and there is no virus can attack them. So there is currently no evidence that any supplement can boost our immune system and treat or prevent any viral infections except vitamin C. Though we are telling we need to follow the nutritional guidelines, dietary guidelines, we have to take all the diet, whichever with all the nutrients, but all the nutrients are supporting to maintaining the health. But which nutrients is really helping to improve our immune system and sustain the immune system means we can say that that is vitamin C. So vitamin C is one of the major constituents of water-soluble vitamins, which tends to make a strong immune system. As we know that vitamin C is the water-soluble vitamins. So this is stands for the vitamin C is meant for keeping the strong immune system. In which way the vitamin C is improving our immune system? If you say means because the vitamin C is a water soluble vitamin, we know that this is the vitamin C is rich in antioxidants. Yes, the vitamin is the C is the rich sources of antioxidants. Vitamin C, you can say that all these lime, orange, all the citrus fruits, we are telling the vitamin C because that is water soluble, and another that is rich in antioxidants. The antioxidants is necessary. Why is necessary? So this is necessary for our body to nullify the free radicals. So what is nullifying destruction? So free radicals. There are many free radicals. Free radicals is what the toxins which is present in our body. The toxins which are the end product of the cell metabolism is the free radicals. This metabolism is taking place. The free radicals is one is it's coming. It's a producing oil there. Free radicals also is coming. The free radicals we need to excrete. How to excrete? If you take the more fruits, if you take the more antioxidant foods, so it will excrete, it will nullify, it will destruct your all the free radicals, the toxins such as which is present in our bodies. Ultimately, we will be free from disease and our immune power is strengthened. So, because in every people used to, once the COVID pandemic has started, not only the physician has advised people to take the vitamin C, all the people used to take vitamin C. What's the daily, according to daily requirement of vitamin C is 90 milligram per deciliter for men and 75 milligram per day. So 90 milligram per day for men and 75 milligram for the women. They are supposed to take the vitamin D. So what are the dietary guidelines the COVID-19 people have to follow to strengthen their immune systems? Let us discuss now. This is the guidelines given by the WHO, the professional and authenticated guidelines for the COVID-19 people have to follow. First, yes, we know that normally we have discussed the fruits and vitamin C is very important. People have to take a lot of fruits. So eat fruits daily, like all the fruits, guava, banana, strawberry, broccoli, pineapple, all the fruit we can, just you can see the orange, guava, vitamin C, rich fruits, all we can take. Taking fruits is not a match. Either are you taking adequate amount which is needed for your body. So I'm taking only one banana per day, 5 grapes per day is not a match. How much we need that much, how much our body is need that much we have to take. So it says that every day we have to take a WHO. Says that every day we have to take a 4 servings of food. You can say the servings in the sense that is 1 servings is equal to 75 grams. So 1 servings is equal to 75 grams. So 300 grams of food you have to take per day. 75, so 300 grams of fruits you have to take. One apple will come like 150 to 200 grams. So like this, altogether all the fruits we have to take care. We should give to the COVID patients 4 servings, that is 300 grams. Because the fruits and vegetables only is improving our immune system, because the fruits and vitamins are rich in vitamins and the minerals. Lot of vitamins and minerals which is present in the fruits and vegetables. Coming to vegetables, this is also rich in vitamins and minerals. The vitamins what we have need are the eat fresh vegetables. Always go for the fresh vegetables like green bell peppers, garlic, ginger, kale, and limes, coriander, dried or fresh corianders, green chilies, broccolis. We can say how much we supposed to take, legumes, beans, and lentils. This is how much we supposed to take. And how much we have to give to the people with COVID-19. That is 2.5 cups of vegetables. 2.5 cups of vegetables. That is also the 75 grams. One serving is equal to 75 grams. So here, just you can measure and give the 2.5 cups of vegetables. Than the rice, we're supposed to take more vegetables. We're supposed to give more vegetables to the people with COVID-19. Then grains and nuts. So the fruits and vitamins fruits and vegetables are it's rich in vitamins and minerals. We need some energy, carbohydrates, and the proteins also is necessary. So cereals, the grains in the sense of all the cereals, there we will be getting all the carbohydrate and the energy. And the nuts is rich in all the proteins. The proteins is necessary for any type of disease, healing all diseases. Eat whole grains and nuts. Whole grains, all type of cereals. So 180 gram of grains, at least 180, because of rice always we used to take one like 2 cups. So 1 cup, this is how 180 gram means how much 2 cups, like 2 servings it will come. 2 to 3 servings it will come. So grains like unprocessed maize, oats, wheat, and millet, so brown rice, and roots like roots such as yam and potato. So this much cereals and the nuts we have to give to the people. Then we use nuts like almonds, coconut, and the pista. So this is all we can use. Protein is necessary for any time to get rid of any type of diseases. Then so people those who want to eat non-veg, how they can take it? Red meat, they can take it as a meat per week. Meat twice per week they can take, and some the poultry products, that is the chicken, egg, fish, that is things which are getting from the animal husbandry. That is called as the poultry, that they can take it 2 to 3 times per week. Either chicken or mutton, they can take 2 to 3 times per week, but fish also, whereas in the egg and meat, so every day they have to take. Snacks, apart from these fruits, vegetables, that grains, nuts, and all, we will be using in the breakfast, lunch, and dinner to prepare. When you go for snacks, the snacks, choose fresh fruits and raw vegetables rather than the foods that are high in sugar, salt, or fat. Avoid irregular snacking. So that's because this is though it is more attractive, more tasty, is very eager to eat, is having its more nutritional value. So we can prefer to take the fresh fruits and vegetables, having a lot of vitamins, minerals, as well as it will improve our immune system also. Starch. So start to the stage, adding taste to the food. We are adding the starch. Make sure the food is prepared and served at the served at acceptable temperatures. It is always better to make a food which we need on the spot, either after morning and afternoon and dinner. You can make the people that are going to eat is a rich, they can prepare on the time and they can eat as. And this is also one of the best measures, preventive measures to avoid all the type of diseases the people those are eating hard. So they will not be getting much diseases related to the GI systems as well as on the other problem also. The limit is at least 5 grams per day. To start, we can advise the people to take, and we also can take only 5 grams per day. Coming to fat, fat also is necessary for body will for maintain the muscle mass as well as for the energy. Here you can have, there is fat, we have a lot of fat rich foods. You say here this avocado, fish, nuts, soy, olive oil, canola, corn oil, sunflower oil, butter, meat, this is ice cream, cheese, everything fat is there, but which one we supposed to take? We can explain to the patient also what are the, because we have the 2 type of fats, you know, that unsaturated fat and the saturated fat. If you say the unsaturated fat, that is rich in you say that is good cholesterol. Unsaturated fat, you can say that is good cholesterol. Saturated, you can say that is bad cholesterol. So this is unsaturated fat is good cholesterol or HDL, high density lipoprotein, and this is about the bad cholesterol or low density lipoproteins. You see here the unsaturated fatty acid always it will be liquid in the room temperatures. This all the oils will be liquid in the room temperatures, whereas in the saturated fat always it's solid in the room temperatures. The butter, cheese, and all this is solid in the room temperatures, and it's difficult to get digest and metabolize. So the saturated fats, you can advise the people to take the saturated fats like the fish, nuts, all the nuts. All the nuts what we have seen, the almonds, badaam, pistas, these all rich in unsaturated fats, good fats we have. So this is we can advise the people to take the unsaturated fats. So coming to eating, so far we have seen you have to eat fruits, vegetables, nuts, this much fat and this much. How to eat, the eating environment, how it should be. The eating environment, how to establish a routine and practice mindful eating. When you eat, you need to concentrate only on the eating. You just distraction of disturbances. Many disturbances will be that we supposed to avoid when we are eating. Establish a routine and practice mindful eating. Here are some tips. What are the tips? Don't eat on the go. It's difficult to be aware of how much you are eating. Have you seen? People used to read just always walk and eat. Yes, they don't know how much they have taken. At least the adequate they have taken or more than that they have taken. They don't. At least they tell the people to sit in one place and they have to eat. Resistant eating straight from the bag or box. Serve your food. You will be able to see and appreciate what much you are eating. Yes, because people will not open the box from the bag, or they will not open from the box. Opening itself, people used to eat, and from the bag itself, people used to eat. Then they don't know how much they have taken and what they have taken. If you are taking and serving and we are eating, we know that how much they have taken and they will be appreciated, although how they have prepared in the food. This is a remove distractions. When we are eating, when the people are eating, they need to remove the distractions like turn off the TV and everything else with the screen like computers, phones. So everything should be turned off when eating. Take small bites and chew well while focusing on the smell, taste, texture of the food. Try to get 30 chews out of each bite. Just one time you have some food you kept in mouth, that's called as bites. That you're supposed to have the 30 chews, you have to 30 times you need to masticate. 30 chews we have to do you have to concentrate and just enjoy your food what they are eating, then they will be getting all the nutrients which is present in the diet. Try putting your utensils down after each bite. Don't pick them back up until you have swallowed. So some people always used to have in their hand itself the plate and what. So that they have to avoid again. That the plate should be down or in the table, and each time they have to take an each. Don't try to finish the whole plate if you feel full. Safely keep the leftovers. People not always, it's true, it's good only, we should not waste the food, but sometimes we may feel it's a fully, I got a society, a full stomach, I can't eat. So okay, no problems, they can left over the remaining foods. So this is all the some mindful eating. So they have to concentrate only on eating. People, those who are eating, so when they are teaching to the patients, or when we are eating, we have to follow this all the eating habits, good eating habits. Be strategic about use of ingredients and prioritize the fresh products. Use fresh ingredients. Yes, what we are going to do now, they can prioritize morning, what afternoon, what night, what they can prioritize themselves, and whatever the products and materials they have, they can whichever is going to spoil easily, whichever fresh, they have to plan themselves to cook and eat every day. That is called this prioritize for the fresh products. The nuts and all will not be getting spoiled for months because the fruits will get spoiled. So first they can finish the fruits, then they can go for the dry items of fruits. Prepare home cooked meals. This all know that because the pandemic situations have given enough time to all the people to be in the home. So people those are working, they will think that I did not have to time to stay back in the home. I don't have time to cook in the home. So people may think that this is a good time because of this pandemic and lockdown has given enough time to people to stay back. So they can use the time, they can utilize this time properly so they can cook it in the home. The home cooked meals is a healthy than the getting food from outside. Take advantages of food delivery actions. Yes, so though the home preparation is good, many people, the bachelor, the people working outside, away from the home, they can't get it. They don't have facility to cook outside. So these guidelines, why I'm telling the people, so many people, they are in the quarantine. So those people also, this may be applicable not only. So this is the guidelines and habits. People with the COVID-19, people with the quarantine and all other the general populations have to follow it. Safe temperatures, because the food always we have to take at the safe temperatures, either the below 5 degrees or above 60 degrees centigrade. They have, we don't know the, we are getting delivery from outside like Zomato, this and that and all. When they have prepared out, they have handled that and all, we don't know. So according to the whichever the local delivery services available, based on that, they can use the delivery food delivery services. Questions answer. Say guidance, though your national food-based dietary guidelines what consists healthy questions for adults, and be mindful that young children will need smaller portions. This we know the just according to the age, we have the some of the dietary guidelines and the recommendations. We have this much people, adult this many grams. So they do everything guidelines is they be conscious when we provide diet to adult, elders, and the young children according to the age. We supposed to give this adequate diet to them. Follow safe food handling practices. This is again one of the essential important measures that people have to follow. The cooking people, handling people, and certain people have to follow. The key principles of good food hygiene include what? We know that to keep your hands kitchen and utensils clean, separate raw and cooked food, especially raw meat and fresh produce. Cook your food thoroughly, keep your food at safe temperatures, then use safe water and the raw material for the cookings. So limit your sugar intake. Again, the sugar also is one of the major component we need to consider when we have consumed it. The WHO is recommending that less than 5% of the total energy intake for adults should come from the free sugars. About 6 spoons, the persons when they are taking, they will be getting the sugars is what is giving the energy, because the sugar, the sweet items is giving the energy for this. So if you crave, if you like to eat like sweet, fresh fruits, should always be prioritized. The frozen fruit, the fruits which are frozen in the freezer, and the canned fruits in the juice rather than the syrup, and dried fruits with no other sugar are also good options. Those the many frozen products we are using, the canned product and frozen products without adding sugar is preferable to have it. When other dessert options are chosen when they are low in sugar, you want with which one is with the low sugar or no added sugar is preferable to have it for the good health. So then which items having the low fat options as that are the often high in other sugars, limit the amount of sugars are having order to the food and avoid sweetening beverages. So we can avoid the sweetening beverages like many beverages is available in the commercials that we can avoid it. Ultimately, this says us we need to less our sugar intake. Yes, this is the important first and foremost things in the dietary guidelines. Everybody have to follow it. Consuming high fiber diet. Consuming high fiber diet. Fiber contributes to a healthy digestive system and offers a prolonged feeling of fullness, which helps prevent overeating. Once we have taken any plain leafy vegetables, so sometimes the 4 to 5 years we will not be feeling hungry. So we will not be going for other food also to take. That another important benefit is this is important for the digestions. To ensure an adequate fiber intake and to include all vegetables, fruits, pulses. Some pulses are rich in the fibers. Grains, some grains are rich in fibers, which in all grains. So how this green leafy is helping for digestion. So when you take the more green leafy is rich in fiber. For the COVID-19 patients, they are taking a lot of medications also. That are more tablet they are taking. So tablet may induce the constipation. Yes, the tablets. Many of the people, when I went for the postings, many of the people have complained constipations. Though I'm taking more medications every day because the morning 10 tablets are taken. Some of the tablets may be the vitamins and minerals, some more antibiotics and the antiviral drugs they are taking. It's making the people to go for constipations when the kids, so at that time, if they consider high fiber diet, it will counter the constipations and they maybe get rid of healthy digestive habits. Yes, this is again important thing. Apart from the diet, the people should be more hydration. Good hydration is crucial for optimal health. Whenever available and safe for consumption, tap water is healthiest and cheapest to drink. But tap water is, you can't say that all the tap water is healthiest. According to the environmental conditions and conditions and where they are taking the tap water, is depending on that. It's also the most sustainable. It produces no waste compared to bottled waters because there are no waste on the tap waters. So drinking water instead of sugar sweetened beverages is a simple way to limit your intake of sugar and excess calories. If you feel like thirsty, we always go for some sugar sweetened beverages like the Fanta, some other things we used to take. So we can avoid that. We can take a water, so ultimately we are avoiding the excess sugars and calories. To enhance this taste, flash, and portion, so to enhance the taste, instead of going for the sugar sweetened beverages to counter your thirst, you can take for the fresh fruits and berries. So this is according to age group, at least per day, how much water we supposed to have it. The children's 1 to 3 years, they have to have at least 900 ml to 1 liter of water. The children 4 to 8 years, 5.5 glass, 1 to 3 liters, 1.3 liters. 9 to 13 years, 1.5 liters. So 1.7 liters for 13 years. And this 14 years, 1.6 liters. And 14 years are lower, so 2 liters. And per day, we have to take the water. This is also one of the another important habit, healthy habits that people have to follow in the pandemic. Avoid alcohol or at least reduce your alcohol consumption. Alcohol is not only a mind-altering and dependence-producing substance harmful at any level consumed, but it's also weaken the immune system. Though you are taking less, moderate, or maximum levels, ultimately it's harming you, it is weakening your immune system. So we can tell alcohol use people always the mind because they are depending on that. So what we can advise them, alcohol use and especially heavy use undermines your body's ability to cope with infectious diseases, including the COVID-19. So people with alcoholic, if they have affected the COVID-19, their health conditions will become more worse than the non-alcoholic patients. Yes, this we have discussed. So how much the people have to take food in the home than the getting outside. So dietary. So far we have discussed the physical measures, what the people have to follow and what we have to teach to the COVID-19 patients, the simple measures and the dietary guidelines. I said that what all the diet they have to take, how to take, which proportions, how to eat and the eating environment. So everything. This is another healthy habits. Coming to third healthy habits is sleep habits. Sleep also, we all know that sleep is one of the important healthy measures to maintain, to sustain the body function as well as to maintain our immune system. So the healthy sleep, what we have to do it, what we should not do it. So drinking coffee before sleeping have to avoid. Drinking alcohol before sleeping have to avoid. Hard training, doing some hard training exercise or training programs supposed to avoid. Watching TV should be avoided, and social networks, using social networks, TV, phones, internet have to avoid it before sleeping. What we can do it to get the sound sleep. So reading, you can do it. You can have a comfortable temperatures. You can take a bath, you have a comfortable temperatures before sleeping. And daily regimens. This you should have a daily plans. By 10 o'clock, I have to go. By 6 o'clock, I have to get up. Like that, the daily regimen, if you have ultimately, we don't think or not, we have to get up. We have the habit of taking wake up at 6 o'clock. But sometimes we used to think that tomorrow I will wake up at 8. No, but what is our regular sleeping time? Automatically, we will wake up on that time. So like that, we should have the regular sleeping regimen. And just mild meditations, we can do it to have a sound sleep, and we have to eat the healthy food before dinner. To get the sound, enough quality sound sleep, what are the measures? Again, the same things. The picture, what it says, the same things only. So we have to establish the regular sleep schedule. Going to bed and getting at the same times. Keep it a weekends and when working for homes. So limit alcohol intake and do not smoke. Avoid caffeine before bedtime. Exercise regularly. Use comfortable bed. We will invite you to go for sleep. Keeping your room and dark at a comfortable temperatures. Disconnect from electronics before going to bed. Try relaxation techniques such as meditations or listening music. If you do this, ultimately you'll be getting sound sleep. Ultimately, your health will be maintained and body functions will be doing normally. How many hours of sleep is according to the age? But we always know that newborn means here they have given the 14 to 17 hours, but newborn needs to sleep the first week 20 to 22 hours, the newborn needs to sleep. Infants 12 to 15 hours, toddlers 11 to 14 hours. In the 5 years of children, 10 to 13 hours of sleep per day. The 39, 6 to 13 years, 9 to 11 hours of sleep per day. Teenagers 8 to 10 hours of sleep per day. This is 7 to 8 hours of sleep for this 18 to 64 years. And the older people 7 to 8 hours per sleep. So when you have the enough sleep, ultimately next day, they will be feeling fresh and they will be doing their day-to-day activity actively. Yes, another important measure is breathing exercise. Because the COVID-19, from the COVID-19, the first organ which is affected is the lungs. So because to keep the lung to do its function properly, that is the respiratory functions, we can do that. There are a lot of breathing technique is there. Here I'm telling the mild, simple, which the people, the patient can able to do it. The simple technique. So take a six deep breath. Deep breath they have to take. Just they have to hold it for the 5 seconds. Then 5 seconds after deep breath, inhale it, just hold it for 5 seconds, and again they have to exhale it. Just otherwise exhale or just to do like a big cough actions. So repeat again that we have to do it for 5 to 10 times per day. For 5 to 10 times on 3 times you can do it. The simple breathing we can advise the COVID-19 patients to do to keep the breathing healthy. Just inhale, hold it for 6 seconds, then again exhale it. So repeatedly they have to do it. Yes, coming to medication adherence. Medication adherence, so what it says adherence, what is adherence? To fix on it that though the COVID-19 patients, medications doctors are prescribing, are they taking or not in on correct time or not? The morning, afternoon, are they taking on the correct time and the correct dose? They have to take it. Then only so they can get it. They can. Every medication is having side effects, yes, and the side effect we need the action of that medications. So we are supposed to take the medications on the situation for what we are taking. So based on the side effect, people will not take. Based on the conflicts, it is difficult to take because of the taste and the smell, they will not take. And they are believing that medication is not necessary for me. I will get my disease. I will get rid of my disease simultaneously without taking medications, and they may forget. They may logistics. That is a big procedures. Doctor, there are 10 medication has given. Doctor has explained this morning, that night, before eating that and all. Because of the complex process, they may not be understanding. They may not be taking, and based on the cost, this is very cost. If I'm taking this, I have to spend for 2,000, 5,000 per month. These all the factors may influence. Though it is influence, they need to avoid these all the factors, and they need to adhere the medications. They have to take the medications. How come we can improve? The ways to improve the taking medications. How? So he's the patient. If the person is taking medications, how that says you can have a light alert. So at the night at 10 o'clock, I have to take a medications like that. He can keep some light alert. He can keep sound alert in the phone. He can keep a ring, tell other people to ring. He can keep a text message, alert text message, the caregivers or family members can give, and we can have the email alert. The caregivers and all the family members have to work collaboratively with the patients to take the medications on the time, to adhere and to follow to take the medications regularly. Yes, this is another important way. So before and all, we used to say, so whenever before eating and after toileting and all, we have to hand wash, but nowadays all the time we need to hand wash. Wherever we go and we come back, we have to take the hand washes. We know hand washing, but how to do and what to eat. This is actually hand washing. But coming to Corona, we have learned some of the new things, the steps of before also we have learned, we are following, but we have not yet practiced on the day-to-day life. But in this pandemic, because of this Corona, we have to follow the proper hand washing technique and the solutions, steps, and times, everything we have to follow it. Yes, the ways to how to wash your hands. So totally 20 seconds you're supposed to wash, and alcohol-based sanitizers or soaps we can use for hand washing. First, what it says, there are 8 steps. First, what it says, use water, rinse your hands. First, just we're keeping the hands under the tap water. Under the tap, then applying soap. Then rub the palm of your hands. Don't forget, it's completely, we are rubbing everywhere, not only the front, the back also we have to rub. Then interlacing of the fingers, not like this, and just we have to interlace the fingers. Pay attention for the neighbors. You have to pay attention for the neighbors. Again, we are washing under the water. Then we are drying. So completely to do this, all the steps, it will take 20 seconds. Again, though the patient has admitted in the hospital, taking medications, taking diet, doing physical activity, everything we are doing, there is some power. He need to become normal and he has to come to his normal life. That is called as the spiritual power. The spiritual power, every people can do. So whoever God and whoever religion they may be, so they can have a belief on his own God, own power, and own religion is necessary. So it is necessary to become a normal, to be away from the COVID-19 patients. Even the hospital employment also. Some of the hospitals, they will create the religious, they will leave the patients on their own religious, and they will be creating some temple and all the religious statues. They will, the people, the patients used to go there, they'll spend time, they'll pray, and they are living that the spiritual power will help us to become the spiritual power also is important for the COVID-19 patients to be that spiritual is the part of life. The everyday you can pray the God on chant. That is the part, is one of the healthy habits. So coming to medications. Meditation. Meditations, mindfulness and meditation practice during this pandemic has potential to complement treatment and is how fast beneficial method of providing support with anxiety for all. Yes, once the COVID-19 patient as well as the general population as well as the caregivers, everybody are panic or anxiety or fear or stressed. So everybody can have the simple meditation. The steps I said before itself, just sit silently in one place, just interlock your legs, just keep the hands on the knees, sit straightly, close your eyes, just close your eyes, have a deep breath, just hold it for 5 seconds, again inhale it. The simple meditation steps, you can follow it. This you can do it for 10 to 15 minutes. Your mind will become fresh and you will be away from stress, anxiety, fear. It's another one, this vaccinations, we all know that now. As many of the people are vaccinated and many people may not be vaccinated. Those people have not vaccinated. So you have to take vaccine soon. So because the vaccine will prevent the morbidity and mortality is related to COVID-19. Yes, so we are taking vaccine for what? To get the herd immunity. Herd immunity. So what is this herd immunity? This is otherwise known as the population immunity. Here, the COVID, who has taken the COVID-19 and people, those who are exposed to, because now we are in the second wave, we are suffering with the second wave. Many of the people may have affected than the first wave. So those people body, they have some immunity, the antibody, the COVID-19 coronavirus antibody they have. So that is called as the herd immunity. And many people have taken vaccines. So the vaccine is producing the antibody against the COVID-19. That is called as herd immunity. Herd immunity, the COVID-19 vaccinations is giving the herd immunity against the coronavirus. So the healthy habits of the people, the optimum healthy habits, the COVID-19 people with the COVID-19, people with the quarantine, with the caregivers, as well as the general populations we are supposed to follow in the COVID-19 pandemic situations. We have seen how to be physically active, what the dietary guidelines we're supposed to follow to strengthen our immune systems, and what all the sleeping, healthy sleeping habits we have to follow, and how to adhere with the medications. Then how to do the medications, how to do the breathing exercise, and all we have seen. That is the healthy habits. Apart from all the healthy habits, this pandemic have taught us some of the basic measures, basic habits we have to follow. This what habits I'm going to tell. This all you know it very well. But even though I'm telling, just I'm going through it, having a review on the habits which we have to follow on this current scenario. The first one is smart. Yes, this all we know that. Staying here, staying safe during the pandemic. Still it lies with us. Still the corona lies with us. We have to stay safe in home. Yes, so we need to function together to tackle the current situations. All the medical professionals and all the healthcare professionals, everything they are working together to tackle the current situation. Yes, many habits, many practice we have to in our day-to-day life, so we can have the little modifications from the behavior line. Change the way you greet. No more handshakers and the hugs. Yes, this you might have seen in some of the scenes, movies, and all. After the corona stature, there is no handshakes and there is no hugs. Yes, this is, you know, that the social distancing is the new normal. Yes, that is 6 feet, at least 3 feet, but we have to maintain the 6 feet distance from one person to another person. Yes, face masks. Whenever you are stepping out of the home, so we always used to wear masks. Keep your hands off your face at all the times. We have to avoid keeping the hands in the mouth, eyes, ears, nose, and the we need to avoid this. Be mindful of your cough and sneeze. So we should be more conscious. This is not for only the COVID-19, the people, when you have cough, when you work in one environment. So when we are in the homes, other people are there, so we should be more conscious. When you sneeze, you should cover your mouth and nose. Yes, this is another hand washing always. After doing some activity, after coming out from outside, we have to wash your hands and wash your hands with alcohol-based sanitizers. Yes, this is no more spitting. When you go for public place, there is no more spitting in the public place. Cleaning and disinfection should be your new mantra. So yes, once you get everything from the vegetable science, always not only getting outside things, inside also, we can frequently just clean it by using the sanitizers or disinfections, because the place we are using, we are touching frequently. Yes, it's not the time to take a summer vacations, avoid unnecessary traveling. Yes, this is not the people and school children, college children used to that. Though college and schools are closed and become locked down since 1.5 years, the people used to move from one place to another place, they like to go. So we need to tell them to avoid the unnecessary traveling. Fight the disease, not the patients. We have to fight the disease, not the patients. We should save the patient. We should fight the disease. So this is, we know that we are doing the no crowded places are social gatherings. We should not go for any crowd places or the social gatherings. There are many guidelines the government has given in order to avoid the social gatherings. Be mindful of what you are posting on the social media. Yes, always should be more conscious what you are posting on the WhatsApp or Instagram. If you keep some wrong information, it will affect many of the patients' mind and the people life. So seek information about coronavirus from reliable sources. Where the information you can get the believable, reliable, and the real information we are getting, we have to seek on depend information only on that source. Can please yes. So if you want some information related to the current situations, we can call for the National Helpline. This is the Indian National Helpline number 1075. So like that, each in every country and every nation, they have some helpline numbers. They can call it as toll-free numbers. They can get, they can call and get the information regarding their health as well as on the coronavirus diseases. So take care of your mental health. Yes, because of this panic, though we are affecting physically, emotionally, that is physically as well as on the economically, or ultimately we will be getting the mentally depressed and our mental health also is affected. So we need to take care of the mental health by doing the meditations and the other way of relaxing. And this is again also get information from the trustworthy sources. So this is the you can take information. So if you have some information related to coronavirus, can I take vaccine? Can I follow these medications? Can I have this activity? You can take some information. So you can go for this government website. This is all on the government website, WHO website. This is good government website, and UK, this is European websites. Like that, you have to go for the government websites. Credible sources where we can believe the information is given is reliable as well as only is reliable information, it's a real information. This is credibility. We can't believe the information. Like some of the news also we can't believe because the news also is not, we can't say that they have taken the act. They got the information actual from the source or patient or from the institution or hospital. And this WhatsApp and this Twitter, this and all, we can't say because if over the individual person what they are feeling, they may share their experience, but we can't tell that it's believable, reliable, or real information. Yes. So far I said these are all the healthy habits we have to follow. So everything we taught the patients with COVID-19 or quarantine, general populations, we have taught how the people are they adhering, are they practicing or following or not. That we need to motivate the people to follow this, all the healthy habits is important. Once teaching, once giving guidelines and leaving whether are they following or not, we will not hear. But still we reinforce, still we motivate. They may be more aware and they can able to follow. So the motivation is essential to follow all the health habits. Even we, once or twice we are hearing a way we will not be doing. Once the reinforce and motivation is coming from our parents or teachers or officials, we like to do. We like to follow it. This is in order to do this all the adherence, we can follow the SMART goal settings. That is SMART. This is acronym which says we want a small acronym which says some information what it is. The SMART means is a specific, S for specific, M for measurable, A for attainable, R for relevant, T for timely. All the health habits we have touched. The patients, we need to tell them, you encourage the patients to get the specific possible about their goals. The patient have to set the goals. I have to follow this physical activity every day at 5 o'clock. I have to eat this food on every day. Like that, specifically, the patient has to have set the goals to himself to follow all the healthy habits. So whatever habits he is following, it should be measurable. Yes, the day by day, the patient, when he follow all the healthy measures, automatically he himself will know that he can see the improvement of health. Once he is not cheating, not following, he will be becoming more sick. So the measures, the habits is measurable that he can able to understand, attainable. The goal, what he said to eat and follow, because in order to get improvement of the goals, the goal is at the yes, you can get it. A reasonable goal only you have set. You can get, you follow all the healthy habits. Surely you will be get rid of the COVID-19, be coming back to a normal situations in that way is the attainable goal the patient has set, and we need to encourage and motivate. Relevant. Ensure that the goal is relevant to the patient. So whatever, because all the healthy habits is a goals. So this is all the relevant to the patient current situations. They can follow it timely. Yes, this is the timely goal. The COVID-19 patients have to follow all the healthy habits. The timeline. Situational habits as well as after the situations, and they have to follow apart from the everyday life also. Apart from this, we have taught them, we said them, we have motivated, encouraged them. Apart from everything, the patient himself has to monitor. That is called the self-monitoring or participating or involvement. Whatever we taught them, whatever we have given them, all the habits you have to eat, to do, sleep, everything. Patient have to involve, actively, he have to participate and do it. That is called as self-monitoring. He has to monitor himself every day. He do this all the habits. Yes. Yes, thank you all. So for your patience listening. So this is not like a presentation. This is again I'm stressing. This is not only for the patient with COVID-19. As all the people in the risk world we are living, we supposed to follow to have a safe life as well as to save us. So thank you all. So this what it says, the first and the greatest wealth is health. This is all we know that. The first, how much wealth we have, the health we should have to enjoy the health. So thank you all. Is there any questions? You can leave the chat box or you can ask me. The first and greatest wealth is health. Yes, Susha.
Yeah, we have a question, ma'am.
Yes.
What is the best time for doing the exercises that I've asked here? So we need to answer for this question.
Exercise, so morning or evening?
Best time for doing the exercises.
Exercise, so morning or evening. So morning is before breakfast. So evening like 4 to 5 before dinner. Yes, Susha?
Yes, ma'am. Thank you, ma'am. Participants, if you have any questions, you can post here.
Can I start my share?
Yes.
Thank you all. 1 second. Thank you.
Thank you very much, ma'am, for an elaborative and useful session. We are getting a lot of compliments for your session and appreciations. And I'm very happy for all your replies. Thank you. And we'll take a 5 minutes of break and we'll continue with the next participant. Now we are moving to the next session. Now I call upon the next participant, Ms. Kanta, Associate Professor, HOD Nursing Research Department. With 13 years of experience, she has with 56 national and international publications, and she has involved in 61 outreach activities. She has had a good experience in organizing conferences and enrichment programs. Welcome you to present the topic, ma'am. Over to you, Mrs. Kanta, ma'am.
Thank you, Usha, for your wonderful introduction. Very good afternoon to you, Vice Principal. So, as part of this international conference, I will be presenting about COVID-19 hypertension. So, out of this presentation, I would like to tell you that in this presentation, we will be trying to understand what is COVID-19, what is hypertension, and during this pandemic, what is the guidance that we are able to give to the hypertension patients. Check in the please. Coming to the introduction, so we know that the novel coronavirus it was first reported in China in early 2009. So this outbreak has now been classified as a pandemic. The main symptoms of this is the fever, cough, shortness of breath, and chest pain. The right time to act on hypertension patients. So first, let me understand what is hypertension. So before that, let me know what is blood pressure. See, blood pressure is the force of circulating. So my voice is audible. Blood pressure is the force of circulating blood against the walls of the body's arteries, the major blood vessels in the body. So hypertension is that the force of blood pressure is excessive. So let me understand. So what is blood pressure? The blood pressure is the force of circulating blood against the walls of the body. The major blood vessels in the body. Hypertension is when the force of blood pressure is excessive. So most people with high blood pressure do not have okay. So most of the people with hypertension are in the pre-symptomatic stage. See, hypertension is diagnosed if blood pressure readings are 140 to 90 or above on two different days. So how many people have high blood pressure? See, if you look at the women, 1 in 5 will be at risk to have this hypertension, and in men, 1 in 4. So 1 in 4 will be at risk to have hypertension. What are the risk factors for hypertension? We know that
salt consumption, low intake of fruits and vegetables, saturated fat and trans fats, being overweight or obese, harmful use of alcohol, lack of physical activity, or tobacco use. So these are the risk factors. What are the consequences due to the untreated hypertension? Heart attack, stroke, kidney failure, blindness, or other complications that can be developed due to the improper treatment of the hypertension patients. So now let us see people with hypertension. See, about 1/3 of adults have hypertension, also known as hypertension. Hypertension is a serious condition that strongly increases the risk of major heart events, strokes, and kidney disease. Treating hypertension usually with medications that reduce the blood pressure significantly lowers the risk of these dangerous conditions. So in this image, try to understand. See, when this SARS-CoV-2 virus is invading into our body, what will happen? How it will be affecting the blood vessels of the patients or the individuals. Means, say, when this virus is entering into the body, so the viral infection, so it will be invading to the lungs, it will be invading to the heart. So it will be invading to the endothelial pericytes. So to the heart, what is happening? So here it will be affecting the microvessels. Okay, the coronary artery will be getting affected. Okay, so here what will happen? So as the microvessels are getting affected, microvascular dysfunction will be taking place. Okay, as the coronary artery and the endothelial cells is affecting, it will be affecting the macrovascular endothelial dysfunction. Okay, and so due to the inflammation, so when this SARS-CoV virus is invading into the lungs, so due to the inflammation, the T cells, macrophages will be increased in number. Okay, and due to this COVID-19, there will be increased metabolic activity. Okay, and on the other side, the pulmonary myocarditis, the heart will be taking place. Myocardial damage will be taking place. Okay, so which will be resulting into the myocarditis. Okay, so due to this, what will be happening? There will be increase in the one CP and there will be increase in the levels of LDH will be taking place. Okay, so due to this myocardial dysfunction, a damage will be taking place. So here, due to this myocarditis, heart failure will be present. Okay, so due to this plate instability rupture, heart failure, acute coronary syndrome will be developing in the individuals. Okay, and due to this myocardial dysfunction or damage, arrhythmias will be taking place. So now let me try to understand the COVID-19 habits of people with hypertension. So here the important thing is so far there is no evidence that people with hypertension have a greater risk of serious COVID-19 infection than people who do not have hypertension. So there is a myth that the people who are having hypertension will be at the highest or greatest risk to develop this COVID. But so far there are no proven or scientific studies states that the hypertensive patients will be at higher risk to develop this COVID. Also, there is currently no evidence that the types of medications used to treat hypertension alter the probability of getting COVID-19 disease are changing its severity. So there is no need for people with hypertension to change their medications. People with hypertension should also follow rules for protecting themselves from disease. Okay, what are they means? So the general recommendations are frequently wash hands also. At least 20 seconds of hand washing is not possible. Use an alcohol and clean. Avoid touching your face. If you cough or sneeze, do it in a tissue and then discard it, or if it is spread out your mouth. Use household cleansing sprays or wipes to clean commonly touched objects, for instance, mobile. Avoid people with illness who might be affected by the virus, like fever, cough, shortness of breath. If you have these symptoms yourself, remain as isolated as possible. You can inform your own doctor or source of healthcare defense of going with person. Maintain social distance about 2 meters and 6 feet people who appear to be healthy. Avoid crowded places. This includes buses and trains, although sometimes it can be difficult to find alternatives or to provide care for people. What are the focused recommendations for people with hypertension means? Continue taking blood pressure medications as prescribed. In the clinical practice, what we have observed is once the patient is admitted into the COVID. Okay, so they will be stopping antihypertensive medications. They will be taking only the corona antihypertensive drugs. Okay, or
antiviral drugs. There are some dietary supplements they will be taking, but they will not be minding about antihypertensive drugs. So this is what we have to clearly to take the prescribed antihypertensive drugs. If possible, measure blood pressure at home. It might become somewhat lower and higher than usual. But if possible, do not change treatment without first talking to the doctor. Remember, low blood pressure can result from poor hydration. So always keep hydrated. Make up a schedule to ensure that throughout the day they have to drink fluids on a regular basis. And next, another important thing is physical activity. So because many of us will spend more time at home to minimize exposure to the virus, it is likely that we will also use physical activity. So what is the solution for this physical activity? Going for walks outside the home, provided social distance is maintained, and it is healthy and even more boosting activity. People with hypertension are high risk. So some people with hypertension are at a particularly high risk of the complications of hypertension as well as from the COVID-19. So the following situations require special attention, like older individuals over 60 are at increased risk of poor outcomes from the COVID-19 flu as well as from the hypertension. So be particularly vigilant in observing the limitations. Do not hesitate to get mental help if they are developing the symptoms. Various heart conditions, stroke, or kidney disease. So be careful to take all prescribed medications, follow all recommendations already given, and be prepared if anything is needed. So here, if the hypertensive patient is getting COVID-19, so here first they have to self-isolate. So continue treatment with antihypertensive medication according to the guidelines. So no need to adjust medication or stop like AC inhibitors or ARBs because of COVID-19. Continue to monitor blood pressure at home if possible. No need to routine clinical review COVID-19 pandemic. Use video or phone consultation with hospitalized hypertensive patient with COVID-19 infection. Unless hypertensive or there is acute kidney injury. So here these are the main reasons that they can be admitted into the hospital. Continue treatment with antihypertensive medication according to the guidelines. No need to adjust the medication and stop because of the ARDs. Monitor for arrhythmias, which may be more common in hypertensive patients with cardiac disease. Check plasma potassium with hypokalemia is common in hospitalized COVID-19. Parental antihypertensive medication only rarely taken in mental situations. Here they're saying that now currently they're saying multidisciplinary therapy approach can help the hypertensive patients. Really monitoring the patient tracking, lifestyle education, period observation, suspected or established hypertension. Perform mechanical determinants like suspected or established hypertension. Older adults, medically underserved people, high risk patients, patients with multiple comorbidities, isolated patients with the heart attacks. Okay, so through this, what we can achieve is that treatment intensification, regular adherence to the treatment, reduced frequency of visits, improved quality of life, improved medication adherence, improved drug safety, reduced management of cost, improved outcomes, hospital assessment. Okay, so by all this, what we can achieve is improved blood pressure control. So in conclusion, I would like to say that so all the for this COVID-19 and the hypertension guidelines. So here SMS. Okay, so what is SMS? Safe distancing, using masks, sanitation. Okay, and as along with this, hydration, physical activity, regular checkup, and if they are diagnosed with this COVID-19, they have to continue the antihypertensive. Thank you very much.
Thank you very much, ma'am, for your short and sweet presentation. So our participants might have knowledge of all these topics from the morning of London. Now let me hand you my ma'am.
Good evening to all.
Smita? Yes, ma'am.
Is Kanta session completed
Yes, ma'am. And the session completed.
so quickly? That's all. Now we are ending with the conference.
Yes. Today's session is concluded.
Okay.
So now we came to the end of today's session. Before winding up, I just want to mention the take-home message of today's session of our eminent speakers. Dr. Indira ma'am, in the keynote address, discussed the importance of our theme, why we have selected this particular topic for this conference. And also ma'am emphasized on role of frontline workers in post-COVID sequelae. Next, Dr. Valli ma'am explained the symptoms of COVID-19 and how to modify our lifestyle habits. Dr. Vasanta Kumari ma'am explained in detail about epidemiology of COVID-19 in second wave and also given a beautiful explanation of second wave characteristics. And when we come to Dr. Ramesh Prasad sir, he has highlighted the statistics and epidemiology of neglected topical diseases and also emphasized on strategic preparedness and response plan for COVID-19. And sir has explained in detail about WHO guidelines for implementation of neglected topical diseases programs. Professor Jayanti ma'am discussed in detail about the role of nurse-led clinic in post-COVID sequelae and also nurse-led clinics services in different populations like children, women, geriatric group, etc. And Professor Vijay highlighted the need for focusing optimum health habits during this pandemic period, and it was a wonderful session. And many of them have raised many questions regarding the many doubts, and they have asked regarding this session. And Professor Kanda discussed the risk factors of hypertensive patients during pandemic period and what are the recommendations we can focus on for this group of patients during this pandemic period. So with this, today's session is coming to an end. And tomorrow again by 9 o'clock, we'll start with this session, continuation of the session will be there. Till then, bye.
Now, session.